I've treated over 1,000 clients with sharp, achy shoulder pain and gotten them back to working out without surgery, without resting it, and without injections. And so when you see that many people with shoulder pain, the same patterns show up over and over again. And a lot of them go against what most people with shoulder pain are being told to do right now. So in this video, I'm gonna walk you through the 5 biggest things I learned, the mistakes I see common recreational lifters make over and over again, and that's why the pain still continues to linger and stay stuck. And I'm gonna tell you what actually gets a weak, painful shoulder stronger again. The first one is the one that nobody wants to hear, so I'm actually gonna save it for a second. Let's start with what's really going on when your shoulder hurts. When it comes to having a painful shoulder, rest is never the answer. Almost everyone who walks in has tried the same thing first. They rest it, they ice it, and it works for a little bit. The shoulder starts feeling better because you stopped provoking and irritating it. But here's what rest is actually doing. While you're protecting that shoulder, it's actually getting weaker. And a weaker shoulder is a shoulder that hurts more, not less. Let me tell you about a past client we had so you can see how fast this can really decline. Let's call this client Brad. You see, Brad used to be able to bench 225, but then after a month, his shoulder started hurting, so he backed off to lighter dumbbells, 20 to 40 pounds. But that still hurt. So then he stopped doing upper body workouts completely. And because of this, not only did the shoulder not recover, it just kept getting weaker and weaker. And so within 60 days, he had gone from benching 225 to having pain washing his hair, pain lifting a cup of coffee, and pain at night when he rolled onto that side while he was sleeping. So by the time we saw him and he came into the clinic for a shoulder assessment, the painful shoulder was already about 50% weaker than the other side. And it wasn't just the shoulder anymore. His trap was compensating so hard that the pain was shooting up into his neck, and not only his neck, but also radiating into his shoulder. And so 60 days of rest is what did that to him, not the original injury. And so the day he finally came in, we loaded that shoulder up with the correct exercises that actually targeted the root cause. And on the initial evaluation with the right targeted exercises, we dropped that neck and shoulder pain from a 4 out of 10 to a 1 out of 10 pain immediately. He was back to dumbbell bench pressing in 4 weeks, and by week 6, he was bench pressing 135 on the barbell again, 185 by week 8, back to 225 by week 10. 60 days of rest made it that much worse, and 10 weeks of loading it correctly got him back to exactly where he was before. And so if your plan for a painful shoulder is to keep resting it, that's the plan that's still keeping you stuck. Which brings up the next obvious question. If you're not supposed to rest it, are you supposed to push through the pain? And that's the second thing most people with shoulder pain get wrong. The second mistake is the exact opposite of the first one. These people who decide the fix is to grit their teeth and push straight through the pain. That's just as wrong as resting, and here's why. Inflammatory pain is a signal straight from your body. It's your body telling you that the load is more than what your tendons and tissues can handle right now. And when you push through it, you keep that shoulder inflamed and you keep the whole inflammatory pain cycle going. So you've got 2 camps, right? One camp that rests until the shoulder pain wastes away, and the other camp that pushes through it until it stays completely inflamed and it never goes away. And both of these camps constantly stay in pain. The line is simple to say. The exercise intensity has to be hard and pain-free. High effort, very low and 0 pain. If it's hard and it hurts, that's counterproductive and you're feeding the inflammation. If it's pain-free but easy, it's not really doing anything, and we'll get to why in a minute. So the effort isn't the problem, the pain is the problem. Same movement, wrong load, and you've turned a good exercise into one that sets you back completely. Now finding that line, hard but pain-free, on the exact right movement for your shoulder, that's the part majority of people can't figure out or eyeball on their own. And that's the whole reason why our shoulder assessment exists. We put a load on the shoulder the right way, and we find the correct exercises that are hard enough to force the tendon to adapt to get stronger, but position it properly so these exercises don't provoke pain. It's different for every shoulder, so we dial it in completely on a shoulder assessment that's done completely virtual, one-on-one with a shoulder specialist. And that's what we do at MotionRx. And so if you want us to find the root cause of your shoulder pain and find the right loading techniques for it, just book in a call below. And once you understand the right findings, you'll see why picking the wrong exercise is the exact thing that wastes months of time for people and keep them stuck in this constant pain cycle. The third finding is the one that explains why most people do shoulder exercises for months and still don't get better. You see, your body is phenomenal at compensating. And so when a movement gets hard, your big, strong muscles jump in and take over for the weak one. So if you think you're training the shoulder, but the deltoid or the pec or the trap is doing the work, and the tendon is actually the one that needs to get stronger, but it never gets loaded because of all these compensations. You're not fixing the imbalance, you're feeding it. The small rotator cuff tendon is usually the weak link compared to the larger muscle groups around it, and it'll stay that way if you don't target it properly. And so here's the contrast. You can have a big compound movement like an incline dumbbell bench press that works the shoulder and the pec for sure, but it does nothing to isolate the smaller rotator cuff tendon. And so compare that to something like a side-lying dumbbell uppercut. You lie on your side, dumbbell in your hand, elbow at 90 degrees, and you punch up against gravity. That position forces your posterior rotator cuff, the infraspinatus and teres minor, to do the work, and it keeps the deltoid and the upper traps from taking over. And that's the difference between an exercise that looks like shoulder work and one that actually isolates and targets the tendon. So here's the takeaway that you can use today. 3 things have to be true at the same time for a shoulder exercise to actually be effective and work. 1, it has to isolate the weak area so nothing else can compensate. 2, it has to be pain-free. And 3, it has to be hard. Genuinely fatiguing, somewhere around a 7 out of 10 effort or in fatigue level. If you miss any one of these, you're gonna be spinning your wheels. Too easy of an exercise and the tendon never actually gets the load it needs to adapt. Too painful and you keep it constantly inflamed. If you don't isolate it properly, then the big muscles steal the work and you're just constantly feeding the imbalances. So take whatever you're doing right now for your shoulder rehab and run it through these 3 criteria. Majority of these people are failing at least 1 or 2 of these, and that's why they're still dealing with shoulder pain. 4th finding, and this is one that surprises almost everybody, a shoulder that clicks and grinds is not normal. Most lifters assume that clicking is just a quirk, a noise, nothing to worry about, but in reality it's not. Clicking usually means the shoulder is unstable. The joint just isn't controlled the way that it should be, and that's why you're hearing it. And I can tell you how consistent this is. Across these cases, about 95% of clients that we see have had a clicky, noisy shoulder on the painful side and a quiet shoulder on the side that didn't hurt. Same person, one shoulder clicks and hurts while the other is completely silent and fine. You see, that's not a coincidence. The good news is the clicking isn't permanent. As the shoulder gets more and more stable and the tendon gets stronger and sits where it should sit, the noise will slowly go away on its own. So if your clicky, painful shoulder is the one that's making noises, take that as information. It's your body telling you signals and signs that your tendons and muscles need stability, and not the fact that you're stuck living with it for the rest of your life. The last finding is a belief I want most to take away from people because it's the one that makes them want to give up before they even start. It's the idea that shoulder pain is simply due to age, something that you're supposed to just accept because you're getting older. And here's what's wrong with that. There are thousands of people who are older, who have arthritis, who have all the wear and tear in their body, but they have no shoulder pain. You see, if age and arthritis were the cause, every one of them would hurt, but they don't. The pain isn't due to aging. It's the weakness and the neglect of taking care of their bodies that makes the shoulders symptomatic and painful. Let me give you a shoulder pain case study that proves it. For the sake of the story, let's call her Carol. Now, Carol was an older patient of mine that came in at 72 years young. She was convinced that pain was just due to her age. She was an ex-tennis player, and by the time I saw her, she couldn't even lift her arm up above shoulder height due to pain and stiffness. And every healthcare provider that she had gone and seen had simply told her that's just what being 72 looks like. However, when she came to us, we didn't treat her age. You see, age is just a number, and the human body is incredibly adaptable if you have the right stimulus and the right environment. We treated the strength with the perfect amount of intensity from a strengthening standpoint. We got her range of motion back in her shoulder, got her shoulder and her rotator cuff tendon stronger, and most importantly, we got her confidence back. And 4 months later, she was back to playing tennis again and serving overhead with her tennis club again. 72 years old young, and the thing that she had written off as aging turned out to be a shoulder rotator cuff that just needed to get stronger and more mobile with the exact correct exercises. You see, how you take care of your body now is exactly what dictates and decides how you feel in the future and how much more you can do in the future as well. You see, getting older doesn't mean giving up and handing your shoulder over to pain, weakness, or instability. So those are the 5. Resting isn't the answer. Pushing through pain isn't either. You have to isolate the tendon. Clicking means instability, and the pain is never due to old age. If there's one thing to check first, it's how your shoulder actually moves right now. So the next video I want you to watch is my shoulder range of motion tests. It's a few simple checks and tests that you can do on your own at home to tell you exactly where your shoulder is stuck and what your body is trying to tell you. Click that one next and I'll see you there.